going to do is demonstrate how I'm going to put on this external fixator. If we assume that we've made a little incision in the skin, I've gone down to bone with say a mosquito just to clear this, the soft tissues, and I'm going to drill straight from front to back. I'm going to take that out, wash it out, cool the drill down, and then I'm going to go in through my down here again, back out again, and then wash out all the swarf. Okay, so that's my first pin.
When you bring in the swarf out and you've got it on power, do you run the risk of widening that first cortex hole?
No, drills are designed to bring the swarf out. That's why they have the spiral thing on them, so that they're designed to work correctly when they're running forwards. So the swarf will come out without endangering it. The risk is if you reverse it, it then pushes the swarf between the drill and the bone. That's when you can jam the drill or break it. If you keep it running forwards, if you're running clockwise, as you come out, it does its thing correctly. Then that's how they're designed to work.
And your drill is still much thinner than your half pin. So even if there is a bit of a wobble,
yeah,
your half pin is still much wider than your drill.
So this drill, the drill that I've just used is 4.5, and I'm going to use a 6mm pin because some people use 5mm pins on the tibia, but I think in a normal adult, if you try and use anything smaller than the 6mm, you're just going to get so much bend. It's almost no use, and you just haven't got the stability, and the patient still suffers pain. If everybody's used to the Hoffman 2 equipment, I take it. Everybody use Hoffman, right? Okay, so you have can introduce the pins, and you can put the cap on either side, so that this one takes the smaller size pins, and on this side it takes the larger size pins. So put that in. It's not going to work now. There we go. And now introduce that. Hopefully that's going to form my going hole. You can see that I've put in quite a few pins, but there's still a little bit of wobble. And if I was having to try and cut through the bone with a self-drilling, self-tapping screw, you can imagine that it really wobbles quite a lot and it destroys the...
I must reiterate, don't ever put screws in on power. It's tempting because it's quick, but it causes so much heating. And also the risk that you won't be able to feel the direction you're going, and you'll miss the second cortex hole and burst the back cortex. Drills on power is a bad idea.
Now, how far out?
Screws on power.
Yeah.
Screws on power.
How far do you go out of the other side? Well, you can see that there's some thread on the pin, but there's a certain amount of the pin which doesn't have any thread in it, and you need to have, for a greater pull-out strength, you need to have thread, at least one thread, completely out on the other side. Okay, so that's why it's worth taking X-rays just to be sure that you've gone through the other cortex. And you might have to rotate the limb a little bit, or rotate the X-ray in order to do that. So that's my first pin. I'm going to spread this out so it's file one. I'm just going to do this in quick. I'm just going to drill the other two on the other side. It's actually quite tricky sometimes because you've got an apex to the bone. There are little guides which can sit on either side of the apex so that you don't slip down the slope. But if I just get this out, oops, he said. I'm just going to do this just pretty quick. What I'd like you to do is when you done yours, I want you to try changing all the factors that we've talked about and see how stiff your construct is. So, yeah. The beauty of the Hoffman and in fact all the monolaterals is that there's everything is universal, and with the Hoffman 3 they've got these little delta clamps, and what they allow is that you can put on a bar or a different size pin. So this one, it's got 8, 11 and 5, so it takes a 5mm pin or an 11mm bar or an 8mm bar. And we're going to just try and connect together these two at the top. So we're going to try and... It's very difficult to get all your pins in perfect alignment and have one bar so connecting them all, because you always end up with one that's just a little bit skew. So what you can do is you can join 2 together there, 2 together there, and then join the 2 together in the middle. Okay, and that's what Hoffman's particularly good for. On the Hoffman 3, so there's some new toys for actually joining bars together. Okay, so that's what we're going to do. Great. So, 6 on there, just a little thumb wheel. So, that take 8, 11 or 5. So I'll take those.
Another 6 here.
So, you can join those together, and if I want to get the bar as close to the bone as possible, then I can put it down there. So let's take a short bar. Short. And they just clip on. Okay. So I've got that down as low to the bone as I can. Put them all the same 6.
They're color coded. The greens are the 5, and the green metal color is 6. But if you're somebody who wants to keep it really simple, and if you're using hand-loaded pins, they're fantastic. There's only one clamp you need for everything. They fix pin to rod, pin to pin, rod to rod, the whole works.
So now, if I tighten all these up, I can actually connect the pins to this bar. And I could connect this bar. That's all right.
That's rod to rod.
1, 2. I should be able to. Okay. So and then if I tighten everything up, I've now got something that's fairly rigid, and then I could put another bar across the top. So 2 more bars there. That's a demonstration of how you're going to put on a simple monolateral for a tibial fracture.